Raymond Singleton, Case Study 5 by Jesse Gladney and Jennifer Joseph. Theories help social workers better understand human behavior and the social environment. Understanding of theories assists social workers in helping their clients improve their daily lives. Theory-based interventions are supported by evidence and are effective in treatment and prevention. Social learning, social conflict, and psychoanalytic theories are all very important to understanding an individual's behavioral history, what impacts behavior, and how to change behavior. Case study 5. We have Raymond Singleton, who is a 25-year-old male. He is reportedly engaging in same-sex sexual activities with multiple partners. He received a lot of gratitude, love, and kindness from his biological siblings, maternal grandmother, and foster parents of 15 years. His parents reported that he exhibited low mood and low self-esteem, low energy, and lack of interest in things he once enjoyed. He was recently admitted for symptoms of pneumonia, and he also denied intravenous drug use and contact with a person with tuberculosis. After testing and examination, Raymond tested positive for both HIV and syphilis. Social learning theory. Social learning theory was introduced by Albert Bandura in the 1960s. It says that behavior is created through observing the behavior of others. Social learning theory was first developed after Bandura and his colleagues observed children's behaviors, both aggressive and non-aggressive, towards a life-size doll. Social learning theory explains behavior in terms of behavioral and environmental influences. Some advantages of social learning theory are able to explain behaviors, can be tested empirically, able to develop a study design that can exhibit whether individuals learn behavior or not through observation, able to change behavior with reinforcement. And disadvantages are lack of ecological validity, focuses too comprehensively on social factors, and downplays cognitive processes. Social learning theory application to the case study. Assessment. Raymond received a lot of gratitude, kindness, and love from his foster family, siblings, and maternal grandmother. It's likely that he is typically in a good mood and demonstrates the same kindness, gratitude, and love he's always been shown. However, Raymond has been showing low mood and lack of interest in the things that he once enjoyed, as reported by his foster parents. Planning and intervention. We decided to connect Raymond to support groups for LGBTQ males to reinforce positive behavior from peers, encourage routine testing and checkups every 3 to 6 months, and stop and think awareness interventions. Social conflict theory. Social conflict theory was based on the philosophy of Karl Marx. It focuses on conflict between the upper class and the working class and poor. Marx believed that conflict theory between the wealthy and the poor were rooted in the unequal distribution of resources. The social conflict theory sees social problems as the product of an unequal society rather than the individual. Some advantages of social conflict theory are that it acknowledges the role of economics in social problems, empowers the individual to strive for economic equality, provides an understanding of how conflict affects change, recognizes society's major differences, and provides the framework for other conflicts such as race, gender, sexuality, religion, etc. Some disadvantages are that it places less emphasis on the individual thinking and behavior. It neglects social stability. It's difficult to measure empirically, and it's complex and difficult to apply to the real world.
Okay, I'll take over from there. Social conflict theory, the application to the case study. Um, so a social conflict theorist on the assessment phase would be interested in Raymond's relationship with his siblings, his grandmother, and his foster parents. There could be a lot of conflict and give and take. Um, for resources between his siblings for attention, affection, validation, etc., from both his biological grandmother and his foster parents. Another thing a social conflict theorist might be interested in would be the conflict between the homosexual community and the heterosexual community. Homosexual community is smaller and has less power, is generally more disenfranchised. So I think that would be something they'd be really interested in examining with Raymond, and how that conflict sort of is shaping the person that he is at this moment. Um, it, the case study didn't mention anything on educational inequalities that Raymond may have faced, but if he was in a foster program, it's very possible that he did not receive the best education growing up, faced the hidden curriculum. Once again, it's not something that we know, but it's something that a social conflict theorist would be very interested in. And then the most important one I think that we identified was evaluating his current predicament, from a social problem versus a medical problem. Um, Raymond is currently in a conflict with the hospital in which Raymond is trying to acquire resources, i.e., healthcare from the hospital, while the hospital is trying to acquire money from Raymond. Um, and obviously, his physiological diagnoses that he's received are a medical issue, but a social conflict theory would be really interested in the societal aspects of what caused those issues to be present. For the planning and intervention phase, um, I think step one would be assisting Raymond in getting the best possible medical care. Like I said, he is currently going to be in a conflict with the hospital, in which the hospital wants his money. Raymond needs the best care that he should be allowed to get. So I think step one for social workers is helping Raymond to get that best possible care through navigating all of the different resources and things at his disposal. Connecting Raymond with LGBT organizations would be an important aspect as well. So that would, with the attempt to sort of help mitigate some of the problems that he might be having with the larger society as a whole, um, in that conflict, and then giving Raymond resources for health literacy. Um, he may not be the most health literate individual, and just sort of helping to equip him and empower him with as many tools at his disposal that he might currently not have, so that he can mitigate what's going on currently and avoid this situation in the future. So we'll move on to psychoanalytic theory. The definition of psychoanalytic theory is the theory upon which psychoanalysis is practiced, which stresses the mind's use of unconscious mental processes to drive thoughts, feelings, and behaviors. That's from Encyclopedia Britannica. It originated with Freud, but has grown and shaped a good amount since then. The most popular or well-known aspect would be the id, ego, and superego, where the id is our basic sort of unconscious drives and desires. The ego would be the more thoughtful and analytical aspect, and then the superego is the combination of the two, which develops the human mind and sort of controls thoughts and behavior patterns that we experience. There's a lot of aspects to psychoanalysis, which I'll go over very briefly. Most people are probably familiar with the Rorschach test, which is a series of different ink blots, where the client will then associate what they think of or visualize when they see them. That plays into free association, which is when a therapist will bring up a word, and with sort of as little thought as possible, the client is asked to respond to like what that thought, what that word elicits. The concept between Rorschach and free association is just to sort of connect the client to more lower level or subconscious thoughts to what they're actively thinking about. Interpretation, it sort of plays off that as well, just helping the client to understand what it is that they're thinking in a more analytical way. Confrontation is the use of sort of bringing undesirable thoughts to the client and sort of forcing them to confront them, which the client may not be willing or very well equipped to do. Transference and countertransference can happen with the therapist and the client and can be a negative or a positive thing. It's essentially when the client or therapist sort of gives thoughts and feelings to each other that they have for other people in their lives. It can be a beneficial thing for a therapist, as if a therapist can embody some of the personalities or perspectives of a trusted individual in that client's life, they can really quickly build a lot of client trust, which is sort of the foundation for really any good therapeutic setting. The understanding of defense mechanisms, things that the client will use to sort of avoid or fight off unwanted thoughts or feelings. Fixations, understanding what the client struggles with, can't really get over as well. Um, Repression, what things are the client really pushing down? What thoughts are they really, really not wanting to have to experience? And this can be conscious or subconscious. And resistance, what things are the client really struggling to deal with? Moving on to advantages and disadvantages. The advantages is that it helps the client to understand their mental development. A psychoanalytic theory would really be interested in Raymond because it does directly address sexuality. It goes deeper than medical interventions in that it's very intensive and long. So it goes deeper than medical interventions and a lot of other therapeutic styles. It deals with object relations, which is essentially us as humans' need for relationships. And it can help clients to get to the root of their problems rather than just sort of brushing at the surface of them. Some of the disadvantages is that has possibly an overwhelming amount of jargon. There's so many um, different definitions and tools that the psychoanalyst uses that it can sort of be overwhelming. Analysis paralysis, which is basically that psychoanalysis sort of deals so much in analyzing everything that maybe it doesn't work on fixing things quite as much. So it sort of develops a pattern between the therapist and the client where everything is just being analyzed and there's always deeper and deeper levels that you can go with it. And not enough action gets taken on it. There's definitely outdated ideas like the Oedipus conflict, um, phallic stages and stuff like that that really sort of maybe discredit or give it a bad name that aren't really used anymore. Um, it can underemphasize conscious thought patterns. So much thought and effort is into the subconscious that for the conscious aspects maybe doesn't give enough credit. It underemphasizes individualism in that um, it sort of tends to lump humans together into certain patterns or roles, and then it can implant false memories when you're analyzing these deep subconscious thoughts. It can sort of people can come up with false memories, which then can cause issues and problems. Application to the case study, things that a psychoanalyst would be interested in. Raymond is 25. He is adopted and he is homosexual. He was admitted with symptoms similar to pneumonia. He's febrile, hypertensive, tachypneic, dehydrated, and oral candidiasis. Tested positive for tuberculosis, HIV, and syphilis. Denies other high risk activities, IV drug use, risky sexual encounters. Has 2 foster parents, 3 biological siblings, and a biological grandmother. Reported a very stable family relationship. And the parents report he's been exhibiting a low mood, decreased self esteem, apathy, and mysterious pains lately. For the planning and intervention, um, the sessions would be proposed at 4 sessions a week at 50 minutes each. Generally, psychotherapy is 3 to 5 sessions a week, so that would be right in the middle. The focus would be on assisting his self identification of his mental and emotional state, as well as focus on assisting subconscious thought patterns. The key issues I think a psychoanalyst would want to address in no particular order are his depressive episode, trauma that he's experienced from his childhood, being in a foster program, trauma from his sexuality, and current trauma from his medical issues that's developing at the moment. Also, self-esteem issues and his sexual relationship history are things that a psychotherapist would be very interested in addressing as well. In conclusion, all 3 theories approach problems for different perspectives and as such attempt to solve them with different techniques. Social learning is about behavior as a learned practice. They'd be really interested in helping Raymond to learn new behaviors, more positive or pro-social behaviors. Social conflict theory is thinking about how humans operate with a mindset of conflict over consensus. So they'd be really interested in the different conflicts that Raymond is in at the moment. Raymond versus the hospital, Raymond versus his siblings or his parents. Um, and they would be really interested in assisting Raymond in mitigating those circumstances for better outcomes. And then the psychoanalytic theory is about unconscious mental processes, helping Raymond to create a fuller understanding of his mental processes that drive his behavior, really focusing on the subconscious thoughts and the things that maybe Raymond isn't quite aware that he's doing. And that is the end. And those are our references. Thank you.